Good afternoon. My name is Janine Salente, and I'm the Executive Director of the Diabetes Foundation. Thank you for joining us today for our first session of our Diabetes Care Month, Diabetes Through a Pandemic, during a pandemic. As you know, if left unmanaged, diabetes can cause serious complications. It was for this reason that the Diabetes Foundation was formed 31 years ago and continues to exist today. As you may know, diabetes impacts almost half the residents of the state of New Jersey. Almost 1 million people are living with diabetes and 3 million are living with prediabetes, many who don't even know it. The Diabetes Foundation's programs are dedicated to serving children and adults throughout the state, from Bergen County down to Cape May. We serve individuals who are uninsured and underinsured. We serve people who are at risk and living with prediabetes, type 1, type 2, or gestational diabetes. Our services include education centered around the 7 areas of diabetes care, such as healthy eating, coping, activity, medication. We offer support groups for youth and for adults, and financial assistance programs that provide free insulin, free monitoring supplies, free transportation, free A1C screenings, and free camperships to go to local diabetes camps. Each service and our comprehensive model helps individuals to get on track and stay on track with their diabetes care and offer the opportunity for optimal blood sugar control necessary to delay onset and reduce complications. Our Diabetes Care Month sessions are bringing together healthcare, nonprofit, and government leaders to offer information to help all of us understand diabetes and how to manage it. My hope and that of our staff and our trustees is that things that you will hear will inspire you to call us directly, to share information about our services with your friends, with your family, with your patients, so they can come to us for care. Before I turn the session over to our moderator, I want to thank our Diabetes Care Month supporters for their generosity, because without their help, we wouldn't be able to offer our programs for free to residents of New Jersey. Thank you to BD, Essentia, M&T Bank, the Russell Berry Foundation, Healthcare Foundation of New Jersey, Horizon Foundation for New Jersey, Sanofi, BioReference, the George Link Charitable Trust, Association of Diabetes Care and Education Specialists, Bergen Newbridge Medical Center, Wegmans, Nanette M.P. Bryan Foundation, and the S. Rubenstein Foundation. Today's session will underscore the importance of prevention, early detection, and keeping safe during these uncertain times. Throughout the presentation, we encourage you to ask questions by using the Q&A feature at the bottom of your screen. I would now like to introduce our host to begin today's kickoff session. Stan Glazer is the Worldwide Vice President of Medical Affairs and Business Development at BD. At BD. Stan is a diabetes expert and a member of the Diabetes Foundation's Board of Trustees, as well as our executive committee. Thank you for leading us through today's event, Stan. I am officially handing the session to you.
Thank you, Janine. It's my absolute pleasure to be here, and thank you for the invitation to host today's event. It's critically important, as diabetes is definitely an epidemic that has been here for a long time before COVID showed up, and will be here long after we put COVID pandemic in the rear view. So we do need to continue to focus on the management of diabetes and support of people living with it. As you know, diabetes affects the nation, and many people living in New Jersey do have to think about management of diabetes, whether it's for themselves or for their loved ones or for their friends, whoever they are providing the support to. So, and with the COVID-19 pandemic, some of the issues with diabetes management became much more accentuated. If you think about diabetes, I mean, it's kind of easy. You only need to manage your diet, exercise, lifestyle, financial health, take your meds, and follow the diagnostic assessments that your physician recommends, as well as stay in contact with your healthcare team. So that's it. It's kind of simple, right? Well, it's not. So if you think about the impact of COVID-19, it's hard to imagine any of those aspects not impacted by the pandemic. Anything from the financial considerations, such as costs associated with procuring supplies or medication, to the ensuring appropriate nutrition, to the effects of staying home, which did limit the ability to be physically active or to maintain the appropriate diet that a lot of patients need to follow, to the stressors that do impact our ability to sleep well and maintain certain routine and regularity. So all of those issues do impact diabetes management. And we need to think about it not just from the perspective of what happened when COVID hit, but also what's going to happen when we hopefully going to start going back to normal sometime soon with the rollout of the vaccination. If you think about people who now have figured out their routine at home, now suddenly they need to start thinking about commute back to work, right? That's not a couple of hours in your day for some of us. And how does that fit with the schedule, right? What are you going to do with the kids who you were seeing at home and who might not be, going back to school or to daycare, whatever they were going, at the same time? So there are a lot of disruptions that will be introduced and the stress that will be introduced with the return to normal. So in this continuously changing environment, diabetes management is incrementally more difficult. So with this in mind, we do hope that today's session will shed light on some of the issues of diabetes management through the COVID lens, and we will have an opportunity to discuss the importance of regular screening for diabetes so that those living with diabetes can pursue appropriate and early treatment, and those living with pre-diabetes can seek appropriate diagnosis. So with this in mind, in order to get us started, I would like to launch the first poll for today. So we would like to get your feedback on the question of, do you feel that quarantining due to COVID-19 has prompted you to live a more healthier lifestyle or less healthier lifestyle? So please provide your response and make your choices. Once you hit the submit button, the answer will be recorded and we will review them later in the session. The poll will stay open for a couple of minutes. So with this in mind, I would like to move to the first speaker of today. Our first speaker has offered pre-recorded comments directly from Washington, D.C. And it is my pleasure to pass to the next section of the agenda, which will be led by Cory Booker. So Cory Booker, as a New Jersey junior senator, has brought an innovative and consensus-building approach to tackling some of the most difficult problems facing New Jersey and our country. He has emerged as a national leader in the effort to fix our burden and broken criminal justice system and end mass incarceration, helping craft most sweeping set of criminal justice reforms in a generation, the First Step Act, which became law in December 2018. He has also advocated for economic policy that expands opportunity, increases wages, limits corporate concentration, and cracks down on corporate policy, practices like outsourcing, stock buyout, and no-poach agreements that firms use to keep wages down. But most importantly, Cory Booker has been a leader in the Senate in the fight to protect the Affordable Care Act, which also, while also championing proposals to build upon the law, increase access to care and lower costs. So without further delay, Senator Cory Booker of New Jersey.
Hi, it's Cory Booker. I would like to thank the Diabetes Foundation for giving me this opportunity to speak about the crisis we have in our country. There is a rising epidemic in diabetes today. We know that while COVID-19 has exposed the vulnerabilities we all have, from access to care to just the general vulnerability of those who are living at greater healthcare risks with less access and less care. But the diabetes challenge we are facing must have our urgent focus. As my fellow speaker, Dr. Zilbermint, will attest, the current health emergency will eventually subside when it comes to COVID-19, and people will see us returning to some semblance of normal life. But we cannot go back to that normal. The epidemic of diabetes is going to continue and continue to grow. Diabetes has become such an epidemic across our state and across our country that it has left so many of our communities facing devastating realities. Almost 1 in 10 New Jersey residents are living with diabetes, and even more, an estimated 36% are living with prediabetes, and many don't even know it. While diabetes is manageable when it is monitored, but when left uncontrolled or mismanaged, the condition can be catastrophic. This is why I'm here today, to help make it clear to our communities that knowing how to manage the condition is of vital importance, that getting screened is of vital importance. And I will tell you, we know that proper action could help prevent diabetes and even reverse it. So it is critical that we recognize that the situation we have, the diabetes epidemic, like so many other health crises, is something that we have control over, even though right now it is disproportionately affecting those in the Black and Hispanic communities. Look, even the highest prevalence of this disease affecting low-income people of color does not mean we cannot do something about it. Ensuring that these communities are educated about the risks associated with diabetes and the importance of a healthy lifestyle when you're at risk of this condition. All of these things are the vital steps that we can take to help with overall health and well-being in America. So first and foremost, I believe that access to proper health care and insurance is vitally important. We all must be committed to that for all Americans and those living with diabetes, not only for their care after a diagnosis, but again, also for preventative care to ensure that more Americans are aware of the risks of developing diabetes or prediabetes and the difference simply a healthy lifestyle can make in their lives. As a proponent of the Affordable Care Act, I hope that all Americans can have access to affordable and easy to understand insurance and healthcare options. I believe we should all see healthcare in America as a right. But even then, support doesn't stop at the doctor's office. That's where organizations like the Diabetes Foundation can step in. The Diabetes Foundation offers support and resources to those living in New Jersey with diabetes, providing things like short-term medication assistance, personalized education, and those who are recently diagnosed can get transportation to and from doctor's visits, can be helped to find long-term solutions for their care, and providing key supplies like test strips and glucose monitors. This help is incredible. That's why I'm such a big fan of the Diabetes Foundation. They've proven their commitment to those living with diabetes throughout the state, even through this terrible COVID-19 emergencies. From supply kits announced by Governor Phil Murphy last spring to help alleviate the stress of going to the store, as well as their programs with the State Department of Health to target populations in and around all of New Jersey that have particularly high prevalence of diabetes. I'd like to introduce the next speaker and say a little bit more about Dr. Zilbermint, who is doing some exciting work with his research between COVID-19 and diabetes that recently was published and subsequently shared through a Washington Post article. I tell you, Doctor, you and your work is inspiring me, encouraging me, and beginning to show how vast the realm of expanded possibilities and promise for all Americans, for those with prediabetes or diabetes, and I want to thank you.
We thank Senator Booker for his heartfelt and genuine words, and I apologize for the technical difficulties with the sound. I hope you were able to hear his message. As Senator Booker mentioned, our next speaker is Dr. Mihail Zilbermint. Dr. Mihail Zilbermint is an assistant professor at the Division of Endocrinology, Diabetes and Metabolism at Johns Hopkins School of Medicine. He is the chair of Department of Medicine, chief and director of endocrinology, diabetes, and metabolism at Johns Hopkins Community Physicians Suburban Hospital in Bethesda. So a lot of very important titles. After completing endocrinology fellowship at the National Institutes of Health, he established endocrine hospitalist and inpatient diabetes management service at the Suburban Hospital, which is a specialized clinical consultation program designed to promote better glycemic control in hospitalized patients. This initiative helped save his hospital hundreds of thousands of dollars by reducing the length of stay of patients with diabetes. His specialized diabetes team won the Johns Hopkins Innovation in Clinical Care Award in 2017. Dr. Zilbermint's research interests include diabetes initiatives, genetic causes of hypertension, primary aldosteronism, rare adrenal tumors, and interconnections between diabetes and climate change. Dr. Zilbermint was one of the first to deploy inpatient diabetes telemedicine during the COVID-19 pandemic. He is a passionate educator and teaches endocrinology fellows, hospitalists, pharmacy residents, and nurse practitioners. Dr. Zilbermint is currently pursuing Master's in Business Administration at the Johns Hopkins Cory Business School with the goal of developing high-quality hospital-based endocrine practices. With this, Dr. Zilbermint.
Thank you so much, Stan, and good afternoon, everyone. So my name is Dr. Mihail Zilbermint. I'm an endocrinologist and a diabetes expert at the Johns Hopkins Medicine. I specialize in the care of patients living with diabetes, especially those who are admitted to a hospital with a COVID-19 infection. I also want to thank the organizers of this very special event for the invitation. New Jersey is very close to my heart. I have family who lives in Fort Lee and Livingston. And finally, I also want to thank the U.S. Senator Cory Booker of New Jersey for a wonderful introduction. So let's talk about diabetes. So what have been seeing among our patients and what have been seen in the hospital? So we have been seeing an increase in the number of patients with uncontrolled hyperglycemia, which is a high blood sugar, at Suburban Hospital in Bethesda, Maryland. That's where I'm based. And we also noticed that there's a lot of patients with diabetes and high blood sugars coming for the entire Johns Hopkins health system. And in March and April of last year, when we were initially scared, we all spoke together. We got together on Zoom meetings, phone calls, and I spoke with my colleagues around the country and abroad in Europe, and we all seen the rapid increase in patients with diabetes. And I'm like, something is going on. So at Suburban Hospital in Bethesda, Maryland, which is one of the Johns Hopkins hospitals, I run a multidisciplinary inpatient diabetes management team, which we have a diabetes educator, we have a nutritionist, we have a pharmacist, and others who all help patients who live with diabetes and admitted to the hospital. So we would usually have maybe 15 or 18 consultations per day. And then in March and April, we noticed a significant increase in the number of consultations, which almost doubled. So it would be unusual for us to see 30 or 35 patients per day. So you're going to ask me, so why is this even happening? Could there be a bi-directional relationship? So we already know that obesity or patients who have obesity or patients who have diabetes or those who have high blood pressure at a highest risk for getting a severe COVID-19 infection. Additionally, we started seeing a new onset of diabetes and severe metabolic complications of pre-existing diabetes, including diabetes ketoacidosis, which is a life-threatening condition, life-threatening complication of diabetes. And then we realized that some of the patients that require an exceptionally high dose of insulin while they're in the hospital. I have a patient recently who usually required about 30 units of insulin per day. And while hospitalized, she required close to 300 of insulin per day. So you're going to say, well, does it make any medical sense? So maybe, and we're still learning about it. We know that the virus, which is causing COVID-19, may bind to a special so-called receptor in our body. And pancreatic beta cells, those are the cells in our body which are producing insulin, as well as some of the cells in the fat tissue which participate in the regulation of glucose and the sugar in our body, have those receptors. So it's plausible that SARS-CoV-2, which is the name of the virus causing COVID-19, may cause the change the way our insulin-producing cells are working. So I want to spend a few minutes talking about prediabetes and COVID-19. So you're going to ask me a question, hey, like could this patient possibly have been on the brink of a diabetes diagnosis and COVID just tipped the scales? So it is possible. We know that many people live with prediabetes, and approximately 88 million of all of the American adults, more than 1 in 3, and this could be you, it could be one of us, have prediabetes. And the risk factors for prediabetes are being overweight or obese, age 45 or older, and race and ethnicity may also be a factor. But what's interesting that those are very similar risk factors for worse outcomes in the case of a COVID-19 infection. And of course, because 8 in 10 adults with prediabetes don't know that they have it, you have to get tested. And we'll talk about it in a few minutes. So I told you that the prediabetes is a condition before type 2 diabetes where blood sugar levels are higher than normal, more than 100, but not high enough yet to be diagnosed with type 2 diabetes. And even though people living with prediabetes, they don't have a full type 2 diabetes, but it already puts you into high risk category for getting type 2 diabetes, heart disease, and stroke, and maybe COVID-19. So if you have prediabetes, we know that you can prevent it and cut your risk in half by eating healthy and getting more active. And we'll talk about it more in the next few minutes. And also we can spend some time in the Q&A section talking about it. And if you all need some extra information, go to cdc.gov/diabetes and you can learn a lot about diabetes and prediabetes. So why am I spending so much time talking about prediabetes? Because if you ignore this condition, your risk for type 2 diabetes goes rapidly up. And type 2 diabetes increases your risk for serious health complications, which I see because I care for patients who come with those complications to the hospital. So blindness, kidney failure, heart disease. This morning I saw a patient who is fairly young. He's 64 years old, and he had diabetes, but he said, well, doc, I'm not really checking my sugars. I know it's been uncontrolled. And he came to our hospital with a heart attack. And because of diabetes, now he requires a heart bypass surgery. So he says, well, I think I suspected that my diabetes was now well controlled, but I had no idea that because of diabetes, now I need a heart surgery as well. We also know that patients or people living with type 2 diabetes are more prone to have a stroke. And finally, we still see people who lose their toes and feet and legs, even in the 21st century. So how to prevent diabetes? Well, obviously the website of the Diabetes Foundation has great resources. First, you have to ask your doctor to get tested. A1C or hemoglobin A1C or glycolated A1C, it's all one name for the same test. It's a great way to get quickly tested. You don't have to fast, but also fasting sugars. And there are some other tests that you can get to get tested for diabetes. But also eating healthy, being more active and lose weight, even though it sounds easy, like Stan Glazer said in the beginning, it's actually quite complex. And you may need to work with a team of specialists and also get a family buy-in to make sure that you can eat healthy, be more active. And if you'll go to cdc.gov and look for a diabetes prevention program, and you can type your zip code or town where you live, and you'll find a few diabetes prevention programs. Many of them are covered by Medicare. Many of them would provide you no cost, a very low cost classes. So I highly recommend it. So let's go back to diabetes and COVID. So you're going to ask me, so what do we know about diabetes and the COVID connection? And why should we even study this? So my colleagues, Stephanie Amiel and Dr. Rubino from the King's College in London and United Kingdom, established a robust database where so-called COVID-DIAB project, which allows researchers and clinicians to submit information about their patients. And I'm sure there are going to be more research papers describing the extent of this new onset diabetes will come out of this registry. So stay tuned. We'll have more information in the next few months about the diabetes and COVID-19. This is the website, and you can read more about this project later. So COVID eventually will be tackled, but what's going to happen with COVID in the next year or two? So remember, COVID-19 is a respiratory virus, but spreads from human to human, making quite an efficient pandemic virus. Perfect. So by the time the severity of COVID-19 pandemic was recognized, unfortunately, the virus had already seeded many parts of the world, changing our focus from containment of the virus to mitigation. And the scientists at Johns Hopkins and around the world predicted that moving forward, COVID-19 will establish itself as one of our seasonal coronaviruses like common cold or flu. I honestly do not think I'll ever go without a mask at work in a hospital again. The diabetes community in this country and abroad is thrilled. It's absolutely thrilled that vaccines have been highly effective. And in fact, many countries prioritized people living with diabetes to receive the vaccine. I have a family who lives in France, and they were able to receive vaccines sooner than others just because they have diabetes. So masks and vaccines. And I want to say that the shot is especially important for you because many of you have history of prediabetes or diabetes. And I personally believe that this vaccine is strongly recommended. So when vaccines became available for healthcare workers, I jumped in. I tried to get as soon as possible. So I personally was vaccinated as soon as the vaccine was available. I got vaccinated on December 23rd. That's when I got a first shot. And then I ensured that everyone in my family did the same thing. So if you haven't gotten the vaccine yet, please do me a favor. Go to vaccines.gov and sign up today. You can also locate the nearest vaccine site, and make sure that your children who may be eligible to get the shot in the coming 1 or 2 weeks will get a vaccine as well. Pfizer, which is one of the producers of the vaccine, just announced that adolescents 12 to 15 years old may be eligible for the vaccines as well. Remember, if the kids will start getting the vaccine, we would protect them for the upcoming summer activities and also prepare them for the next school year. And finally, I want to say that even though COVID-19 pandemic will eventually will get better, people living with diabetes will still face the challenges and will still be at the risk for worse outcomes in case they catch COVID-19. So what would be like with living with diabetes in the post-COVID-19 world? In the future, we need to focus our efforts in our country and state and Maryland, New Jersey, on the better pandemic preparedness. We need to be more aggressive to characterize and identify unknown diagnoses quickly. There will be more pandemics in the next 100 years. We need better containment strategies and better medication to treat the virus. Though we've got some good medications, and I think the outcomes in the hospitals significantly improved in the recent year. So if you are admitted to the hospital with COVID-19 or any other reason, and you live with diabetes, please inquire if the hospital has a specialized diabetes team that can follow you as well. Even if you're coming to the hospital for some other reason, like let's say pneumonia or a broken leg or something else happened. We established in the inpatient diabetes management service a specialized diabetes team at all of the Johns Hopkins hospitals. Make sure that the needs of those living with diabetes are met. There is more coming to the market. Some of you may be using a continuous glucose monitoring system. So now some hospitals are also offer patients, those who have COVID-19 and diabetes, the option to remote wireless CGM or continuous glucose monitoring. It's like glucose monitoring telemetry or similar systems, which has potential to reduce those point of care glucose testing or finger sticks, also reduce the nursing staff exposure to COVID-19, and also reduce the PPE utilization or personal protective equipment. Finally, I want to shout to telehealth. That's a wonderful thing. We were one of the first one at the Johns Hopkins Health System and across the country to deploy the inpatient diabetes telemedicine. So telehealth is not going anywhere. Please do not delay medical care. Please schedule in-person or a telehealth visit with your primary care doctor or your provider, your endocrinologist. It's very easy to do. Now some of the insurance companies even covering the phone calls. So telehealth is here and it's not going anywhere. You don't have to leave your house. Call your doctor, schedule an appointment. Finally, I have a little COVID vaccine warning. This is a possible side effect for seniors. You may encounter lots of children running around and families getting together. And with this final slide, I want to say on behalf of my entire team at the Johns Hopkins Medicine, at Suburban Hospital where I'm based, I want to say thank you. I want to thank the Diabetes Foundation for the invitation. If you have any questions, please feel free to email me. You can follow me on Twitter. And I think we're going to have a few minutes to take some questions, right?
Yes, thank you, Dr. Zilbermint. That's an excellent overview of the situation, and it's a very challenging topic, especially considering how much reports on diabetes and COVID have been published and communicated in the past months, and not all of them have been consistent, right? I mean, we were talking about, yes, there is an increase in risk of diabetes. No, there is not. And, it's very difficult to discern because Obviously, diabetes is a highly prevalent condition, and when we're watching for associations, it's difficult to figure out if we're seeing an impact because of diabetes or it's just, one of the things in the background. So thank you for that, and also thank you to your institution for the leadership and stewardship in management of COVID and diabetes from the very first day of the pandemic. So before we take questions, I would like to launch our second poll for today. So the question is, when are you planning to have your next A1C screening? In the next few months, in the next year, 2 to 5 years, or what is an A1C to start with? I mean, I think you addressed this in your presentation, but I don't know if everybody paid attention to every single point. So please provide your answers and we will review them in a second. So with this in mind, I would like to also welcome the questions from the audience. Please submit your questions using the Q&A function at the bottom of your screen, and we will take them as they are being entered. We have about 15 minutes left to the session, so yeah, we have time for a few questions. While you're typing, maybe let me start with a couple of questions that I have. So one of them, I mean, you mentioned the vaccines and the possible side effect that suddenly you can hug your kids and see your grandchildren and return to more or less normal life. That's all great. One concern that I heard voiced from the people living with diabetes is that diabetes is known to be associated with some suppression of immune function, right? I mean, that's why people with diabetes see maybe somewhat higher rate of infections and maybe somewhat higher rate of some other conditions. And the concern is, okay, if I have immune function compromised to start with, and now I throw in vaccine, will I get sick? Will the vaccine work? Is it even worth doing it if I'm not going to build antibodies? So there is this whole hesitation about the immune status in diabetes and the need to vaccinate. Can you comment on this?
Yeah, I think it's a outstanding question, and I understand that many people are concerned, and it's okay to be concerned, right? So remember that the millions of people in the United States and around the world have already received COVID-19 vaccine, and these vaccines have already undergone the most intensive safety monitoring in US history. So we know that people living with diabetes are at risk of worst outcome if they catch COVID-19. So we know that the COVID-19 vaccine will help to prevent those worst outcomes. In fact, COVID-19 prevents more than 90% of all of the hospitalizations. I have a colleague who was hesitant receiving a vaccine, and unfortunately he got sick just recently, and he's been hospitalized for almost a month. Remember, if you get a COVID-19 vaccine, it's not gonna make you catch the disease. It's actually gonna help you to prevent catching the disease. And about antibodies, I know we are still learning a little bit more. I think that not everyone you don't need to check your antibodies after you get the vaccine, but we know that the vaccine is effective. It's been tested in our country and around the world, and I'm looking forward for more people getting vaccine in the coming year.
Okay, thank you. So another question that was just posted, when we're thinking about coming from the pandemic lifestyle to a more quote unquote normal lifestyle, how do you think that transition should be best managed, in a sense that, well, if I haven't exercised for a year, should I go for a run the first day? If I have been cooking in a certain way, how do I now manage my meals that I'm going to cafeteria? Like, how do you suggest people transition in the most healthy way and the safe way if they are dealing with diabetes?
Well, obviously, this is another great question, transitioning from one lifestyle to another lifestyle. So obviously, we want you to be having a more healthier lifestyle. And I know some of the people have been sitting at home for a long time. Please be careful. I mean, obviously, if you want to jump and start running 10 miles tomorrow, you may not be fully prepared. My recommendation that you can go to cdc.gov/diabetes, and look up a diabetes self-management program. There are multiple of them, and many of them are covered by health insurance. Some of them are free, and you'll get a coach, someone who would be able to coach you on a daily basis. Sometimes we usually meet initially weekly and then monthly, how to transition from one lifestyle to another. I don't know about all of the conditions, but in regards of the diet modifications, I definitely suggest him to reduce the amount of carbohydrates or potatoes or rice, depends what you like to eat, and less bread, and start transitioning more to vegetables. There is some idea that the high fat, low carbohydrate diet may play a positive role in those um, who live with type 2 diabetes. So that's one of the diets to consider.
Okay, thank you. I guess another question in terms of transitioning to a bit more socially proximate environment rather than socially distant environment, as people are getting vaccinated and we're starting to get together. How would you recommend the person makes a visit for somebody who has diabetes more comfortable, more conducive to their well-being, more safe?
Well, this is a complex question. How to be more conducive and more safe? Um, I don't know. I think that the answer has to be very individualized. What I'm My strategy is to sit down with a person who has a question and sit down and listen and ask them what do they think, because many times people really have their own strategies already ready, and there are some barriers to get to those strategies. So here the my strategies is go to your doctor, sit down and ask them to just spend tell them that the next time you're going to visit your doctor is you just want to talk about diabetes. Because quite often when you come and see the doctor, we spend, let's say, 20 minutes doing one thing and then 5 minutes focusing on diabetes. Just tell them, I want to focus on diabetes and only, and you'll sit down, we'll provide you some answers. I think that would be the best thing. But obviously, everyone's situation is different.
Okay, thank you. I guess a little bit more of a sciencey question, because you mentioned, maybe some cellular mechanism in terms of how COVID affects diabetes. So can you comment on, one, if somebody has pre-diabetes, are they more prone to get diabetes if they got COVID or not? And, if they have diabetes, are they more prone to become, for example, hypoglycemic? So can you comment on those, more pathophysiological impacts?
Yeah, I think that Mike Lane asked this question and about whether patients with pre-diabetes would necessarily develop type 2 diabetes. No, not all patients with pre-diabetes, or not all people living with pre-diabetes develop type 2 diabetes, but they are at high risk. And even whether we develop diabetes or not, we are also at risk of developing a heart disease and stroke. So that's why this condition has to be tackled. So whether COVID-19 is changing some cells or not, we don't know yet. However, we know that the COVID-19 is attacking the cells which are responsible for the insulin production, so beta cells in the pancreas, but not necessarily hypoglycemia. We also know that those ACE2 receptors, which are located also in the fat tissues, which are also responsible for sugar metabolism in our body, also located in the fat tissue. So maybe, we don't know yet, but we don't know whether COVID-19 is associated with hypoglycemia or not.
Okay. Thank you for that. So we have about 5 minutes left, and there's a number of questions still in the queue, so we won't be able to cover all of them today. But what I would suggest is two things. One is probably we'll take you up on your, kind offer to reach out to you directly, but also we will post some of those Q&As on the Diabetes Foundation Facebook page and website. The only other comment that I wanted to make, there is a question about living with diabetes and other conditions, whether this is hypertension, migraines, COPD, whatever that is. So I guess, last quick question, how do you suggest a person manages it from the perspective of relative priority of diabetes, from the perspective of, financial stress, coordination of things? Is there any kind of, magic recipe that you can recommend? And one additional call out, if the person is really in the financial distress, please reach out Diabetes Foundation, because that's what we are there for, to help people who actually do need to have financial support to manage diabetes. So
well, it sounds like
what's the magic recipe?
Well, the magic recipe is, and I think that Karen Gazel asked a great question, as a close family member of someone who is diabetic, what can I do to support them when they visit? So there are multiple resources online and in the community, including the Diabetes Foundation, which can help you to get you those support resources. If you need some extra insulin or you ran out of strips, and strips are expensive, you can reach out to the foundation or Google, where can I get? There are multiple, Endocrine Society, American Diabetes Association, many of them have website where people can get some help. And about the support or magic sauce is that stay positive. We can tackle the challenge together, but you have to come and ask for help from a clinician or from a support organization, whether it's a primary care doctor or a family physician or it's a community clinic.
Okay. Thank you, Dr. Zilbermint. That was very insightful, very helpful. So I'm looking forward to the continuation of this dialogue offline. Before I call back Janine Salenti for a final farewell, I'd like to share the results of the poll today. So Ben, can you please post the results? So it seems like almost even split between people living healthier and people living less healthier. So I guess, congratulations to those who are living more healthier, because that takes, probably an extra effort and the perseverance to do it. So that's great. But at the same time, it also highlights that the challenge is not small, right? And it's not that we choose to be less healthy. It's really the environment that is, problematic, and hopefully we can get back to a better situation. But in the meantime, with this more demanding environment, again, seek help, try to get, support and education as to how you can manage through this time so that you maintain, your healthy lifestyle and avoid those longer term complications of diabetes. So if we can look at the second one. Yeah, when are you planning to have your next A1C? Great response. So almost 60% are saying in the next month. I just hope that that's fewer months than more months. But it also shows that quite a significant proportion of patients will only get it sometime next year, or maybe in 2-5 years from now. I do hope that these people are not necessarily those who are currently living with diabetes. Obviously, if you have no immediate health issues and you're not in advanced stage, you don't need to have the test as frequently. But at the same time, if you are at risk, or if you are living with diabetes and you're delaying the testing for financial reasons or access to care reasons, that is something that, again, you need to discuss with a healthcare professional or with your, support network, or again, reach out to Diabetes Foundation with questions. Would be more than happy to navigate you through this challenge. So thank you for this. And with this, let me pass the thing to Janine Salenti from the Diabetes Foundation to offer some farewell remarks.
Thank you, Stan. Thank you so much, Dr. Zilbermint. Thank you, Cory, Senator Cory Booker. We really appreciate you being here today. We really appreciate all the points you underscored. And one of the major ones, and it's been said throughout this whole session, and it's the reason why we wanted to focus today on prevention and screening, is the Diabetes Foundation works with thousands of people a year screening and prevention are so important because diabetes is hard. It's hard, it's every day. So I'm really glad to see that poll that so many people are going to get their A1C tested in the next few months. That's really terrific. And I just wanted to point out, Dr. Zilbermint spoke a little bit about diabetes education. The Diabetes Foundation is doing virtual diabetes self-management education and support programming. We're certified by the Association of Diabetes Education group, and we hope that you come to our website and sign up for one, because our CDE is providing really amazing support. And although it's a group setting, there's a great interaction between people, and it supports not only education of all self-management areas, but it also provides a support group for you. So we hope that you come online. As mentioned earlier, we have 3 more sessions this month for you. On May 12th at 5 p.m., you can join us for Key Steps to Diabetes Success. Here, our healthcare experts will provide you with an understanding of the standards of care that you need to take as your #1 defense to managing diabetes. On May 19th at 5 p.m., we'll be hosting Diabetes Myths versus Reality, where our team of community leaders will dispel common myths and discuss the realities of living with diabetes. And finally, on May 26th, join us for Finding Affordable Diabetes Care. Here, the Diabetes Foundation and our partners will be able to take you through a myriad of different places, whether government or corporate support programs that can help you find affordable care to manage your diabetes. Please visit www.diabetesfoundationinc.org, our website, to see our resources. And if you want to sign up for the other 3 sessions, you're going to go to /caremonth. Thank you all very much for being here today. We really, truly appreciate your support, and we hope we see you next week.